Welcome to the Tinnitus and Hyperacusis Clinic.
Tinnitus and hyperacusis are very common in children. They are not very much recognized in children, and however we see many children who experience tinnitus and hyperacusis. And the youngest patient that I had was 3.5 years old, and so who was experiencing hyperacusis. And hyperacusis can impact on the life of children very significantly, because unlike adults, it is very difficult for them to avoid certain noises. Hugely, it affects on their happiness and their involvements in their activities in a school, playground, music classes, going to shopping centers, cinema, disco, lots of places that they like to go, they won't be able to go. And even if they are motivated, they are encouraged to go to birthday parties and school. However, the noises bother them a lot and causes a lot of distress and doesn't let them to enjoy. In fact, it makes a nice experience for them a terrible experience.
Cognitive behavioural therapy is very successful in children and typically involves between 3 and 6 face-to-face individual sessions.
I had many patients who were finding it difficult to cope with the noises, and it was causing them a lot of distress in their day-to-day life and for the family life and the parents, because it was limiting the life of the parents as well. They couldn't go to places that they needed to go. The therapy was a fun experience for children and their parents, and they had to work as a team to help the child to overcome their sensitivity to sound. Children often at the beginning of the therapy felt scared when they were hearing noises, but at the end of the treatment they can cope with the noises very well and do whatever they need to do, and the parents are much more happy, and children feel more brave than scared. That is a very fantastic outcome.
Over the last 15 years, Dr. Hashir Aazh has developed and managed several NHS tinnitus and hyperacusis services in London and Surrey. He has written over 25 scientific papers in the field of audiology. His research has influenced British guidelines for hearing assessment, oral rehabilitation, and forensic neuropsychology. In 2009, he was awarded the Josh Miller Shield from the British Society of Audiology.